Good morning and thank you very much for joining us. I am Yori Folani. Okay, we're talking health today, and in that connection, let me say good morning to Dr. Omadele Boyo, public health consultant, who is joining us remotely. Good morning, Dr. Boyo.
Hi. Good morning. Thank you for having me. Yeah.
Okay. Well. Yeah.
Are you not hearing me?
Okay. First of all, Dr. Boyo, we got these 4 million vaccines extra, to our kitty, to our, health kitty. These are Moderna COVID-19 vaccines that have been delivered through COVAX. So help us out, doctor. This is different, even though the two are doing the same job. That is to say, the job of AstraZeneca that we all started with.
Yes, they are doing the same jobs, and they are both good, and have been tested all over the world. And in fact, in the US, there's mainly Moderna and Pfizer. So AstraZeneca has been more popular in the UK and parts of Europe, and then India. So, it's a gift, 4 million doses from the US, and I think we should be grateful for that. So it's good we have it, and it's also equally potent.
Okay. The question has been answered that if you started with AstraZeneca, you've got to finish with AstraZeneca. You can't cross, so to speak. That is, take your first on AstraZeneca, take your second on Moderna. I think I heard the Minister of Health say that that is not the WHO recommendation, and that is not what will be happening in Nigeria.
Yes, to a large extent, private information have it that we still have some of the doses of AstraZeneca. For those who took the first dose, when they are due for their second doses, which is 3 months from the time they took their last dose, they will still get AstraZeneca. What happened now is to get fresh batches of AstraZeneca became difficult because, India, from where we're getting AstraZeneca from, had some grave issues with regards to the number of COVID. So India has had a tough time. So they are not able to produce more vaccines for other countries. They were now facing the fire in their house. So India has not been able to give us more, but AstraZeneca is still available around the world. But Moderna came from the US. So if you have the first AstraZeneca, when it's your turn, you may likely get the second dose of AstraZeneca. Yes. We are now going to concentrate on those who have not even had any vaccination at all. Especially health workers, those working in isolation centers, and those that are in their need. So we will make sure that those who have had the first AstraZeneca, they are even safe with just one dose. There's a level of safety. We advise everyone to take the second dose. And if you have not even taken at all, why don't you get into the Moderna? It's also good, and you'll be safe.
Now, in terms of the numbers required, we have a very serious, in fact, Lagos State Governor Babajide Sanwo-Olu was warning that the third wave is definitely upon us, and he was urging everybody to sort of sit up, as it were, and take due notice and observe all the protocols. But what I wanted to sort of ask about was, now, talking figures, it is said that in Africa, maybe we're getting 4 million vaccines throughout Africa, 4 million vaccines a week. And that is a far cry from, an object that you can tell me better about, the objective of something in the region of at least 10 million vaccines a week throughout Africa. Would you comment on that, how Africa is lagging behind, as it were, in terms of vaccinating its people?
Well, I'll start by saying that Africa has taken God's blessings for granted. Our mobility rate, our mortality rate has not been as alarming as the US, India, and Brazil. Look at what we have in Namibia. Some weeks ago, there were no mortuaries in Namibia. South Africa almost came down to a standstill. In spite of the riots, they are still having so many deaths. East Africa. So in the Sahel, the West Coast here, we've not had such heavy casualty. And that is just unexplainable mercies of God. Because, maybe the sunlight There's sunlight in Namibia, there's sunlight in East Africa. Oh, maybe it's malaria. There's malaria in all those countries. So we tend to take God's mercies for granted. So I think the first thing is that the people themselves are not motivated enough to even take the vaccines. Even if you bring 100 million vaccines to Nigeria, I can bet you will not get to 20%. Right now we're at 1%, and we're trying to even hit 5%. And we're supposed to have 70% vaccinated people to have what we call herd, H-E-R-D, herd immunity. We're not getting there. And the reason that we've got enough vaccines, people are not motivated to do it. People have cried, the government has cried, the newspapers, the TV stations, but people don't seem to believe that COVID in Nigeria is the same COVID in the US or Brazil or Canada or even India. They believe that it's malaria we have here. So there's an inertia, there's a lack of drive among people. Except I have lost 3 people to COVID. I've lost cousins, I've lost friends, I've lost classmates to COVID. I know it is real. And I've seen people that have had COVID, so you can't stop me. But there are people in this country, majority of people in this country, just believe this thing doesn't exist. So the problem is not with the number of vaccines. The problem is getting people to be convinced that COVID is real and get them to take the vaccine. They are not doing that. The houses of worship, the politicians, the influencers, the government leaders should be in front of telling people their own personal experience of deaths. In Lagos now, people are dying. We should stop hiding it. Come out straight and tell people are dying. Show pictures and let people see their cousins. Talk about the stories on TV. Right now, problem is not with the number of vaccines. Problem is the number of people that are convinced that COVID is real and are willing to get a shot in the arm.
You know, that point you brought up, Doctor, about it's the paradox of COVID-19, you know, ravaging areas of the world. And initially, all the experts, you know, statisticians, they were saying that, it's looking quite dark for Africa, considering the level of our healthcare, our healthcare in on the continent. So they thought that people would be dying in droves. And indeed, for a while, it was scary. When it began in 2020, we were seeing a number of deaths. But then it sort of petered out. It's something of a paradox. You were saying yourself that people, you've all attributed it to God's blessings and all of that. But what could you dig a bit more into it? You've touched on some of them. So if it is sun, vitamin D and all of that, yeah, there's sun everywhere. What is it about Africa that, to paraphrase your words, God has been so merciful about, so people are not dropping left and right, and this has now encouraged our people, especially the youth, to say that COVID-19, not such a big deal. I'm okay, I'm good. And as you said, people are almost taking it for granted.
As I was talking with who we are. In Africa, death is a hidden thing. We don't talk about reasons why people die. We talk about the brief illness. If people die of anything, we say after a brief illness. So in Africa, we don't talk about people's circumstances that led to their death. If somebody died last week and I called the doctor, I said, I had a friend of mine died in the hospital. What happened? He said, I said, I was told it's malaria. He said, don't mind it, COVID-19, but we don't even believe it. So that's it. And 2, viruses are very intelligent. When they find out that you have developed a particular kind of resistance and able to get you, they go back and research how to get you. Viruses are not bacteria. They come back. That's why you have the variants coming. They study you, they study your environment, and they come back in a big bang. So whatever it is that is protecting us, people have said it could be the chloroquine in our blood, but there's malaria in many parts of the world. It could be the sunlight. Brazil is in the tropics. India is in the tropics, you know. People have said, our DNA, whatever it is. First thing is that we don't have a very good database. We don't know how many people really are dying in the villages and in the townships. We know that we have people dying. I lost my cousin's husband last week. I lost my another person's husband 2 weeks ago. People are dying, but we always say terminal illnesses, chronic illnesses. And so we don't have the database all over. Lagos is trying. There's the coroner's inquest, there's data, statistics of deaths in Lagos. But how many people really report these things? People bury within 24 hours. If they're Muslims, they are Christians, they cry to their villages. So we don't really know. But then someone will tell me that if it is so, we should have a whole street dying. We should have, I know in Nigeria, if somebody dies in a compound, The next time that person dies in that same compound, landlord will give the family quit notice. Legally or illegally, I'm not promoting it, that's what happens. But we don't tolerate deaths coming frequently. I'm saying it's not our portion. So what is keeping us safe now will still be the little things we did in the first and second wave: physical distancing, washing our hands, closing down churches and mosques and places of large gathering, and closing down schools helped us. We cannot deny that. If we go back and continue the way we're doing, normally we go back to normal, open all our streets, open all our schools, open all our markets, and we don't do that, we will now see what we never saw in the first and second wave. We see massive deaths, but we don't believe it because it never happened. So the preemptory action of the government in the first and second wave, plus what we cannot explain, kept us away from having deaths left, right, and center. Now we've entered the third wave. Government is being more careful. It's not pushing it too hard, because most people live on daily bread, what they make every day. So government is very careful because of the economic reasons, the political situation. Parties are holding primaries left, right, and center, and churches are having vigils. Government is making a lot of noise, but people are saying, if we don't die since we never die, we're not going to die again. That kind of spirit. So that's where we are now.
Yeah, that might be our attitude in this part of the world, our own particular neck of the woods. But I noticed that internationally, scientists are being very, very cautious, and they are actually saying, for instance, that they are apprehensive that the recent Islamic festival that was celebrated, as you know, people came out a bit more, so to say, from their shell, that they are saying that the aftermath of that is going to, become realized pretty soon. And it's like in the Western world, they're sort of gearing up for that. Whereas, as you said, we are taking it very much for granted that, look, if a thing hasn't happened to now, it hasn't happened. But, Doctor, let me take you somewhere else. It bears repeating what the COVID-19 virus can do for you. The fact that, for instance, with AstraZeneca that we started off with, that you've got both vaccines does not mean that you are immune entirely to COVID-19 now. Would you speak about that?
Yes, it does not mean if you have COVID-19, you can contact COVID-19 virus, and you have become a very good enabler of spreading it. Why? Because you will have it, and you can be symptom-free or symptomless. And then you become like what we call the former asymptomatic. When we started this thing, when I would say there are people going around that are carrying COVID-19 and have no symptoms, what we cannot have is that we are now having people that have been vaccinated and are now mega spreaders, because they have been vaccinated, they go everywhere, they don't wear their masks, they just go everywhere. Okay. What's happening is that they will now infect their parents, infect their siblings, infect those who are in Nigeria. Vaccines were given to those who are above 50, healthcare workers, isolation workers, and then the military, people that are doing essential services. There's a large proportion of people in Nigeria. Children have not even had the opportunity of getting the vaccination. Young people have not gotten it. Now, the adults who have had this vaccination will now get the COVID and pass it on, because they think they are free, they go everywhere, they go to the parties, they say I'm free, they spray, they dance, and then right there are people who never believed in the vaccines, never got, or wanted to get, but it never got to them. They now get it and they die. Now, those who are vaccinated can fall sick. They take them from me. But the advantage that they rarely die. Very few, they can fall sick, they can have all the symptoms, but they will survive it. But the question is, what will happen to their children, their wives that never had the vaccines? Those who get sick and die. Okay. That's where the problem is.
Okay. One moment, Doctor. Reverend Dominic is on the line. Good morning, Reverend Dominic, in Alimosho. You got a question for Dr. Boyo?
Hello.
Reverend Dominic?
Good morning, sorry.
Okay, good morning.
How are you today?
Good morning, Reverend. Fine, thank you very much. Have you got a question for Dr. Boyo?
Yes, but I want to make this comment.
Sure.
As we cry that Nigerians are not keeping to the protocol of COVID-19, have you think about our own government? Every nation I know that have more than 50 million people at least has tested about at least 40 or to 60% of the population. It's on record today. Let me not say what they will attack me after I finish this call. Nigeria have not tested up to 4 million people. The last time it was less than 3 million, but let me just give them 4 million. Lagos State alone cannot be saying that they have not tested up to 4 million. If we are serious in our nation, we want to test over 4 million Nigerians in Lagos alone, not to talk of the whole nation. Now that's one side. A friend of mine traveled back to Holland last Saturday. He did this test 60,000 naira. If I want to do it voluntarily, or if I tell him in the church, go and do it, how many Nigerians have 60,000 naira to run this test? So the government in all fronts are not helping matters. Number 2, 3. By today, we got 4 million vaccine yesterday by dash. How could a Nigeria like the rest of Africa depend on dashing vaccine, taking vaccine to vaccinate 200 million people? Are we this poor? The answer is no, we're not poor. We are not poor and we're not poor. We must go for this vaccine to save this nation.
Okay.
If I say it now, you won't like it. God has have mercy on us. Our prayers, God have answered it. If not the prayer of the saints in Nigeria, how will you use this attitude of government to fight what we saw in India, to fight what we saw in Italy?
Okay.
Government are not helping matters.
All right.
4 million people, God have almost tested almost 40, 50 million people. Nigeria have no money.
Okay. Thank you very much, Reverend Dominic. Dr. Boyo, would you like to comment on the Reverend's commentary that he doesn't believe governments are doing enough in view of the severity of the situation?
I want to start by saying I'm not part of government.
Sure.
I'm just a public.
I'm asking you that question as a public health consultant.
Yes. I'm just that. We see the point with government is that government has to understand the people. Government has, see, when the tests were free, people were not coming out. The average Nigerian in public health, there's what is called attitude, knowledge, attitude, and practice. That forms the basis of public health decisions. Once you don't believe this thing exists, you will not go for tests. There are people that even if you bring the test to their home, in Nigeria, our attitude is, what I don't know cannot kill me. People prefer not to know. They have given this thing a name. They say it's just serious malaria. If the government makes it at the beginning, at the first phase, tests were free. You only had to wait to be tested. People are blaming government. The truth of the matter is that there's a state in this country that the governor came out and said there's nothing like COVID-19. There are churches that say there's nothing like COVID-19. There are people propagating conspiracy theories against COVID-19. In fact, stronger than the government message. So talking about testing, I agree with you. The test is expensive. Government should subsidize it. But let me tell you the truth, people will still not do it. Those that are traveling abroad are even faking tests. They're not even doing it. If you can buy a ticket of 275,000, 400,000 naira to go to Europe, 750,000 naira to go abroad, and you are finding you've got to buy to take a test of 50,400. I've done the test. I've traveled recently. I did the test here. When I got to England, I did the test. Before I came back, when I came back again, I did the test. You see, if you can afford to pay that money to travel out, please, 50,400 naira should be affordable. Now, I'm talking about those who don't travel now. All teachers, all health workers, all military personnel, all people that are forced to be exposed to the people by reason of their duties, government should give them a test free of charge. But let me tell you this, will they go? I run a hospital. When I was to get my staff to go for even the vaccines, they refused until I had to make it mandatory. Some people now had to, I told them to sign indemnity. So refused to take the vaccine. I'm ready to face the consequences. People refused. So you can see if health workers can be rejecting the vaccine based on conspiracy theories, you can even imagine the problem government has today is the last AstraZeneca. We couldn't finish it. We stopped because those that are taking the first dose were waiting for them to get the second dose. When they got the second dose, towards the end of the second, people started rushing. They were given. Then so that those that are taking the first dose, if we finish this, they will not get. People are not crying out for the vaccine. It was recently people started coming out for the vaccines. Now, Moderna is here. 4 million doses. If we can finish 4 million doses, it would be a miracle. So the first thing is to mobilize people. Government has tried. It's the influencers, social media hawks, and people that need to get people to know that these vaccines, not even that, do the tests.
Okay.
Do the tests.
I beg your pardon. Let me interrupt you for a moment so that we can bring on Mr. Yakub in Dokbemu. Thank you for holding on all that while, Mr. Yakub.
Good morning, Shibiori.
Yeah.
And then good morning to Dr. Boyo.
Yes.
Shibiori, to be sincere, I totally agree with Reverend Dominic. Severely, if you send your report out today to do the survey, I can tell you, severely, a lot of people have malaria. They thought it's malaria, but it's the other way around. Although they were not conducted. You know why I say so? I have a friend deal with bro. He's operating a pharmacy store. And then, could you believe getting to his store one day, I met a lot of people asking that, market is moving today. His reply is that market is moving, but it's selling malaria drugs mostly now. Usually, you see, Nigerian government needs to do us a favor. Even the figure that came from Lagos, I think yesterday or day before yesterday, that they get 50 or something. It is more than that. It is only that we don't conduct a lot of tests. But now, the question I asked last time, it has been answered today because of the fighting that was given to Nigerian government yesterday, if I don't make a mistake. That then I asked Dr. Boyo one time ago that somebody that took AstraZeneca vaccine, and then if another product comes, and then different from that very particular, can he miss it? But I was listening to television yesterday. One of the people there says that you can't miss it. This Nadala now, some of us that went there last time, they said there's no more vaccine. We are praying that it will go to our local government soon, so that we can be able to go there and say, because Nigeria information orientation, they are already skipped. All this information is supposed to take to marketplace. Because if you tell them to go and take this vaccine, what they normally say is that something that they will take and giving them another sickness. They don't know, because Nigerian government needs to send people to marketplace to make them to know the importance of taking this vaccine. Failure to do so, some of us that we're ready to take, even if we take it, and then the people living in our area failure to take, we can get the virus after taking the vaccine, and then we can see some transmit it to them.
Exactly what Dr. Boyo just explained. Thank you very much, Mr. Yakub, for calling in. Exactly what Dr. Boyo just explained, that you might have been vaccinated. It does not mean you're immune to catching the virus, but you might be asymptomatic, and that means you can transmit because you yourself didn't know. So, yeah, indeed. And Dr. Boyo also explained that, look, government is being cautious. It has to be. Churches, but Dr. Boyo, we have, from my own, eyewitness account, we've virtually gone back to the way we used to be. Parties are opening up again. Churches are less strict. Not saying all of them, but churches are, generally speaking, less strict. Markets are booming in terms of the physical presence of people. Masks, even supermarkets and some establishments that were very strict initially about no mask, no entry, have relaxed it a bit. Not all of them, but the fact that there was almost like 100% compliance before, and now I would guess it's somewhere in the region of maybe 50% compliance. Only 1 in 2 of those who started out very strictly are still maintaining that level of strictness. So I guess we have to appeal to the individual to understand what he is up against, Dr. Boyo.
Yes, last week I attended a funeral, and somewhere outside Lagos, I was with my mask, and I looked like a masquerade. I was the only one wearing mask in the old church. I was the only one wearing mask at the reception. Even who came to look at me, they knew I was from Lagos. It's as if I was carrying leprosy or I was doing something. So I didn't know when my mask came to my chin, because everybody just started they were not wearing masks. So it took a lot of courage to keep the mask on. Now, coming back to what we were saying, the last caller was saying that the testings are not free, they're not done. Let me tell you, there's no vaccine. Even if you don't do the tests, take the vaccine. The last time we had AstraZeneca here, people didn't take it. The surge was not much. It was towards the end. The last minute surge was what we have. Now, Moderna has come. People are not taking. Now, like I said before, if you have taken 1 dose of AstraZeneca, you are quite lucky. You are very lucky. And you can still wait. If you don't get anything, that one can protect you. Stop complaining that government doesn't have enough.
Yeah, but you still recommend, Dr. Boyo, I beg your pardon for you, but you still recommend, even though you've said that even 1 dose is better than no dose, but you still recommend that it must be completed in an ideal case scenario.
Yes, but completed. I'm only saying those that are complaining that they got only 1 dose, they came late. all those, you and I took our doses, immediately came, and we got the second dose.
That's right.
All those complaining, they came in at the last minute.
Okay.
When the people for the second dose were taking their second dose, they came for their first dose, and they got their first dose. Most people got their first dose. But the point was that government stopped it because those that got the first dose about their second dose, those that came late about their first dose, and I can assure you there's a reserve for those. When your second dose is ready, government will make AstraZeneca ready for you. Right now, Moderna is coming. Take your Moderna and you get your second dose of Moderna.
Yeah,
but the question is, how many people will go out and take these vaccines?
Okay.
We will see what will happen.
Yes, and in relation to AstraZeneca, middle of the month, we are expecting a further supply of donated AstraZeneca vaccines from Pfizer. Now, Mazi Okorafo, good morning, sir, and thank you very much for holding on. Please go ahead now.
Good morning, sir. Good morning, Dr. Boyo.
Good morning.
Good morning.
Dr. Boyo, I want to find out from you. At least in Catholic Church, I used to see people come to take the blood pressure of people. That medical personnel, the church will announce that two people are coming. So Sunday, maybe coming Sunday, that people should know that when they see that they shouldn't be afraid. They will come and take, after the mass, to go and do the test. What does it take the federal government or Minister of Health to do such thing in terms of this testing of COVID-19 or Delta virus? And secondly, even the vaccine, even right now they are going around to give people, children, small children, this malaria tablets like this that is going on. They go around. Now, does it mean that the federal government or the state government cannot organize this issue of vaccine so that you go around going down to people? Because look, the hospital, nobody is there, but the question is to have access to entering that hospital and to have access of going to collect the form and sit down, and it's a problem. Can the authority concerned carry these drugs and go? I know you need a refrigerator. Yes, refrigerator and drugs are there. At least that one can sustain it. They go to the religious organizations and both Muslims and Christian and traditional worshippers, they are Christian, and give these things. Because look at what they say, they gave us only 4,000. 4,000 for 4,000 now, like 4 million. So
4 million.
For 4 million. What is Nigerian population? Over 300 million. So it doesn't mean we don't have money to buy, to place more, or the drugs are no longer in the market, or it's cash. Is this cash like Gare and Apple that is cash this time around in Nigeria, or meat? Thank you very much. Have a pleasant day.
Okay. All right.
Yes, if I may come in here.
Yes.
It's like asking me, there are schools everywhere. Yeah, we have children out of school. There are schools everywhere. Some schools are just empty. We have children out of school. Then you have farms everywhere. We have people unemployed. The problem we always talk about in public health is, first of all, attitude. We talk about the knowledge. How many priests in that Catholic church believe that there's COVID-19? Those that believe, how many of them? You see, these testing centers are there. People are not going there. The vaccination centers are there. People are not going there. Now, to do tests alone, to have a molecular laboratory to do tests, it's not like taking tests for blood pressure. You need to be completely covered. People doing the tests have to wear PPE because they don't know who you are going to come across. They have to take these tests, put them inside containers, send the containers somewhere. It's very laborious. So they now said, okay, there are now private laboratories in Lagos. There are not less than 35 centers in Lagos. Go there and get tested. The one in Naima, Lagos State was doing free of charge. I can assure you, if you go there, you'll be tested. We have not reached the level of going from church to church. When the uptick, when people are interested, the first thing we have find out, even as doctors, is that our parents, our friends, our church members, our priests don't believe there's COVID out there.
Yeah.
So going to give people what they don't believe in is like wasting their time. Even polio, for about how many years now, polio vaccine have been discovered. Bill Gates has pumped money into it. Polio vaccines everywhere. People are still not taking polio. You can't believe it. It's just recently that we got polio free. It was a hell to get people convinced. What about family planning? Family planning is free in most general hospitals, and they're doing everywhere. Who is taking it? So what we are saying that our people don't believe this thing exists. Where it exists, they are still arguing whether it's malaria or not. Then when the vaccines come, they say this vaccine will make you impotent. This vaccine is from the white man. Is intended to dig the vaccine in Nigeria. It's not the vaccine in America. Look at the map of America now. All those that took this vaccine in America are safe. The least vaccinated places in America are the ones that are having 98% of the deaths. So when the vaccine comes again now, forget about the tests. It's good to get tested. Get tested, but the vaccine is free.
Okay.
If you cannot afford paying 50,400 naira for this, why don't you just take the vaccine?
Okay.
I know you have taken it. Thank you.
Doctor, COVID is still very, very much with us.
Delta variant is much more deadly and
much more virulent. And Governor Sanwo-Olu was explaining yesterday at a press briefing that the state has recorded 6 deaths daily in the last 1 week. That's coming from Incident Commander Sanwo-Olu. So, you know, they have the figures. And look, whereas it has gone down generally, and we started with your saying that only God knows how he works in wondrous ways, because it wasn't supposed to be like that if you go by statistical and scientific sort of maybe things that you would have thought. But here we have it, 6 deaths, you know, recorded in the last 1 week. I don't know what more proof people need, but it is what it is. Now, quickly, Doctor, in view of this one that has just come, what is it now? The Moderna. One of the other ways it's different from the AstraZeneca is that refrigeration, I suppose, is a lot more particular. It's not as relaxed, so to speak, I can't think of a better word, as the refrigeration for AstraZeneca was. Dr. Boyo, you still with us?
Yes, you're correct. It's not as AstraZeneca. That's why Nigeria went for AstraZeneca. The fact that we understood our peculiar situation in regards to power and refrigeration, we chose a vaccine that we can handle. That's how we went for it. Now, the government must have made plans to have gotten Moderna with the capacity to refrigerate and protect the Moderna vaccine. So I will say that the government is doing a good job. I don't doubt the government, because Moderna is very difficult to manage compared to AstraZeneca. That's why they still have another batch of AstraZeneca coming in the next few weeks. So that's where we are now.
Okay. Dr. Soga, as I was just saying, was you are the Secretary General, National Association of Resident Doctors of Nigeria. And, well, sad news, I'm sure for both parties, for the doctors and the patients. But the doctors' strike started yesterday, and it's total, and it's said to be indefinite. And it is coinciding with Nigeria being officially in the 3rd wave of COVID-19 pandemic. Now, Doctor, I won't ask why, because I think I've read that 119 days or so after an agreement with government, government is yet to, perform their part of the agreement. But are there other facts that we are not aware of?
No. Thank you very much. You are aware of everything, because I remember I was at your studio after the first strike that was declared on the 1st of April. Following that, before the strike on the 31st of March, precisely, we had a meeting with the federal government where a memorandum of action was signed. And because we did not have the powers to stop the strike, we brought what was signed to our members. And our members didn't believe in signing, because we've been signing documents with government, and they told us that they don't have faith in that document. Because of that, they declared the strike. You also recall that the Minister of Health came on air and indicted the association for going on strike, having signed memorandum of action. And it was from him we get to know for the first time that memorandum of action is different from the memorandum of understanding they've been signing. And so we decided to believe him. He said, and I quote, that in memorandum of action, there are timelines within which what they plan to do would have been carried out, and that having signed memorandum of action, we were supposed to have believed in the government and allowed them do those things within the period they stipulated. So we went to our members on the, because of that, we called a meeting again, having declared the strike, and on the 9th we signed another memorandum of action. At this time, we decided to reappraise and put everything together again, and we signed. Because of that signing and the information the minister gave to us, we called a meeting on the 10th and we suspended that strike, believing that all that was said will be done, will be done. But unfortunately, sir, sadly, as we speak, after 113 days, most of the items on that memorandum of action have still not been done. Issues as basic as payment of salaries, issues as basic as regularizing, the platform through which they should pay the salary are still being left undone. We have our members on the GiftMe platform. GiftMe platform is a platform that the government said is fraughted with irregularities and fraud. Because of that, they don't want to use it again. As a responsible association, we agreed with government and we gave them all the support that they needed, that they should migrate our members from the GiftMe platform to the IPS platform. This has still not been done. Till now, our members are suffering.
Yeah, and I also, if you can still hear me, I also hear that the resident doctors are complaining that of the doctors that unfortunately died taking care of COVID-19 patients, only one has so far been.
We have lost about 19 members to COVID.
And only one.
I heard you talking about the third wave of COVID. We are aware. And we are here in Nigeria because we are patriotic. Other clients, those that treated COVID, they are well encouraged. I know that at the wake of the COVID, the federal government came up with COVID inducement allowance, which they promised to pay for 6 months, but haven't paid for 3 months, not even to all our members here. They stopped. Because we are patriotic Nigerians, and we know that we cannot run away from this country. We are here. We lost 19 members. Death in service insurance that has been signed, that they are supposed to pay to the next of kin of our members as we speak. They are not taking it seriously. And we are facing the third wave again. We are saying that they should take the welfare of our doctors seriously. Okay. They should pay death in service insurance to the next of kin of those that have died, so that those that are alive, that are still going to combat this disease, will be encouraged that should anything happen, their wives and their children will not be left to suffer.
But doctor,
and I don't know why these things will take time, will take forever to be done.
But the situation,
so we are asking Nigerians to help us ask those in charge of the health sector. Why are they neglecting the welfare of doctors? Why are they allowing doctors to go on strike? Because I must tell you that we don't like this strike. We have never been proud of going on strike. But you agree with me that if you are not paid your salary as you are there in the studio, you will not come to work if you are not paid for 2-3 months. But here we are talking about 7 months of unpaid salaries in some states of this country. Our members are being owed 19 months salaries, 10 months salaries, 6 months salaries, as the case may be. In Abia State, Imo State, Ekiti State, and on those states.
So as we hear all of this,
the same market that you go to. You go to
doctor,
the market
doctor, as we hear all of this, and I suppose you're making a compelling case. There's a sense in which you even blame the Minister of Labor and the Minister of Health because they are key stakeholders in all of this. But I was going to bring up the point that you say it's a reluctant strike. Doctors don't like it. I started with that. This is not a strike that anybody that can benefit anybody in the sense that there will be consequences. Now, patients generally are left with in the care of consultants and nurses. And here we are, as you've been saying, in the midst of this, third wave and, of COVID-19. It was never sparkling before. It's going to get much worse. And you've said that the strike is going to be indefinite. I don't know. You've made such a compelling case. If people haven't been paid for 19 months, 12 months, 7 months, as you have indicated, it's very hard, I imagine, to continue to be motivated. But your business is a different business. I know you've heard that before. Your business is about life. And I don't know. It must be you've heard this argument, but you said you're reluctant. But now the patients are going to be in a much worse place than they used to be. And it looks like you're ready to go for the long haul by emphasizing that the strike is indefinite. What, doctor, would you say needs to be done at the very minimum for us to begin to approach normalcy in this situation?
Are you talking to me?
Well, I was talking to Dr. Isogun, but maybe Dr. Boyo, let me hear from you, sir. Let me hear from you, doctor. What do you think needs to be done?
Yes, first of all, I'm a senior doctor, so I'm not among the resident doctors.
Yes.
They are the frontline doctors. They are the ones at the battlefront. I put in 40 years in medicine, so I can't be in that category. But then I sympathize with them, because what the health sector is going is pathetic. And that's simply because our leaders have options. They can get out of the country without pride to get treated abroad. So that's why the total money spent on the National Assembly and the political office holders in this country is more than what we spend on health for doctors, nurses, medical equipment, drugs around the country. So you can see that we have parasitic elements eating into health. If you can cut down on the salary, if you just say this, let's give a quarter of the salaries of political office holders to health sector, everything will change. Now, these young men that are fighting this, they have options. The United States government, the UK, Europe are taking them in droves. Every day, not less than 500 doctors are getting out of this country. We will not have doctors again in about 2 years' time, because these resident doctors qualify to work in the UK, qualify to work in Europe, and their entry is now easier. They are begging them to come. So we either take care of them, or we're going to die very soon. Now, talking about whether they should stop work because whether it's right for them to stop work in view of the fact they have not been paid, that's not necessary at all. They cannot be allowed to work for 12 months. It's a shame. You can't have people working without being paid. It's a shame. So I can't even answer the question of whether their competence, whether it's right for them. It shouldn't come up.
Okay, one moment, doctor. Let me bring in Mr. George. Good morning, Mr. George.
Good morning, Uncle Yori.
Thank you for calling.
To all your guests.
Yes.
Uncle Yori, I find it very difficult to believe what I heard the doctor saying, that doctors have not been paid for more than 7 months. People that are saving the lives of others, who is the government paying them? Those that sit in the office and just carry file from one table to the other, you pay those ones, and the ones that are saving lives are not paid. I've not seen a country where that is done. And then we turn around to blame the doctors for leaving the country. You went for 7 years training in a university before you qualify as a doctor. You come out and you're not paid for 10 months, and you want the person to remain there. It can't just work. Uncle Yori, this is enough for your station to summon the Minister of Health to come on air and explain to Nigerians why this should be happening.
Indeed.
Secondly, if you permit me, sir.
Sure.
The first topic that you talked about, I understand the point Reverend Dominic was making. But the truth of the matter is that, like Dr. Boyo said, people themselves are not keen about this vaccine. In the 2 doses that I took on Cleary, I did not spend 3 minutes at the venue. People are not there.
Yeah.
The people that need to be addressed are religious leaders particularly, and community leaders.
Okay.
So the problem is not with the vaccine itself, but with the people. And I want to ask Dr. Boyo whether the Moderna, is it the one that you have to take once, or you also need to take it twice?
Actually, there are two. There are 2 doses, sir. 2 doses to that. Let me go back to Dr. Isogun. What would your comment be? Because the case is so compelling. How can a person not be paid for upwards of 7 months? I think you actually mentioned more than that in the examples that you gave. Is there anything now? Because the first point of emphasis, I think, is that doctors themselves don't like this strike. But among other things, you've also spoken about the facilities, and this goes to some of the things that Dr. Boyo was saying. We can afford better facilities would seem to be the point that doctors are sort of knowing and are now acting upon. So, Dr. Isogun, what can be done at the barest minimum, do you think, in the short term, to better this situation?
Yes, for us, we are open. We want the government to sort out these issues, the basic issues like we mentioned, and we come back to work so that together we can fix the health sector. What we should be talking about now, especially with the advent of COVID that has exposed the health sector, the decadence in the health sector, we should come together now and fix it. You know, like my senior colleague said, most doctors are leaving this country, not because they don't like to stay here, but because they have better environment to work in. They have better remuneration outside. And if you have that, you agree with me that you want to go there. You know, on top of this, as we speak now, let me use this opportunity to tell you that one of the burning issues is that our very junior colleague has just been removed from the scheme of service by the head of service of this federation. So we are asking questions. They need to withdraw that circular so that we can come back to work, and together let us face this COVID that is coming. The circular was released on top of not being paid salary, and you are looking for shortcut, saying that you are paying too much. You are removing some group from the scheme of service just and for no reason.
Have the authorities?
We want them to listen to this, our complaints, resolve them so that quickly we can come to work, so that we can face the next phase. The next phase is how to improve on healthcare delivery in this country, how to fix the health sector.
So what has been the reaction from the authorities to NARD upon the commencement of this strike? Any communication?
No,
Dr.
we are yet
Sogun?
to hear from them. No, we are yet to hear from them.
Oh, yeah, okay. Even though you commenced the strike, you are yet to hear from them. Well, I want to thank you very much, Dr. Jerry Isogun, Secretary General, National Association of Resident Doctors of Nigeria. Thank you very much for making time for us this morning. And also, thank you very much, Dr. Amadele Boyo, Public Health Consultant, for taking us through the arrival of the COVID-19 Moderna variant that we just...